It's Monday morning. Do you know where your employees are headed? Hi, I'm Glenn A. Davis, your workforce care nurse. In 2015, I was fired for disability from a major U.S. hospital. And what happened to me is what has to change for employees going forward. Because where they're headed will ultimately determine your organizational people, performance, and profit. Today, I'm asking a simple question to major U.S. hospital administrators, staff, and faculty to stand at your current employee mental health referral system and take a good look at it. Don't just send your top performing employees into a system you haven't followed them through. Seek out what is actually happening to them. Does your current referral system benefit the employee? Does it improve productivity? Does it make staffing safer? Does your employee return ready to work? Or are your employees taking 12 weeks of FMLA only to return from leave no better than when they left? If they aren't returning better, why not? Ask yourself, is there a better way? Because sending your top performing employees into mental health services for workplace depression and workplace distress could be costing your institution more than money. It can add to the stress hospital administrators are already carrying: increased turnover, disloyal employees, staffing problems, productivity problems, litigation, patient safety concerns, and wellness programs that still aren't solving this unique workplace problem, which is workplace depression. Is not the same as clinical depression. Workplace depression and workplace distress have an actual antagonist rooted in the workplace: discrimination, retaliation, bullying, injury, chronic job stress, the denial of rights, fear of losing employment, fear of losing income, fear of losing health benefits. Those are workplace mental health issues. And when the problem is rooted in the workplace, sending the employee somewhere else does not automatically solve what is happening at work. One is your business problem, the other is a medical issue. Treatment plans exist for both, but the providers are not the same. And when those distinctions aren't made, the employee can receive invasive treatment without the workplace nuances ever being considered. Meanwhile, the workplace condition remains. The employee remains distressed, productivity remains affected, and the hospital continues carrying the consequences. That's why I want you to reconsider what happens before the referral. Stand at your current system, look at what is happening, follow your employee through the process. What happened after the referral? What happened during FMLA? What happened when they returned? Did they return rested? Did they return informed? Did they return ready to work? Did productivity improve? Did staffing become safer? Did you retain your experienced employee? And most importantly, did you address the workplace depression or the workplace distress that contributed to the problem in the first place? Because if major U.S. hospitals continue funneling top performing employees into mental health services for work related problems without addressing the workplace depression, the cost doesn't end with the employee. It reaches the organization, it reaches staffing, it reaches productivity, it reaches patient safety, it reaches turnover, it reaches litigation, and eventually it reaches the American healthcare system as a whole. Hospital administrators already have enough on your shoulders. You're responsible for operations, you're responsible for productivity, you're responsible for staffing. You are responsible for patient safety, and increasingly, you've been asked to carry responsibility for employee mental health outcomes, too. Let workforce care help you carry the load. There is another referral option for your employee workplace mental health issues. Send your top performing employees experiencing workplace depression and our workplace distress to workforce care. Give them access to employee mental health education. Give them an opportunity to understand what is happening to them before workplace distress changes the course of health and their careers. and give your organization an opportunity to retain employees who return informed, prepared, ready to work. Hospital administrators, stand at your current referral system, look at the outcomes, ask, is there a better way for workplace depression and for workplace distress? Provide workforce care, protect your people, protect performance, protect profit.